Syphilis is an emerging threat to the long-term health of birthing people and their babies. As a perinatal nurse, it is imperative to understand the disease and screening and testing strategies. This video provides information on how to interpret syphilis lab values.
Is there something I can help you with?
Yes, could you go over some RPR lab results with me? I'm not familiar with how to interpret them.
Sure, let's take a look. The initial screening test for syphilis is usually the RPR or VDRL, called non-treponemal tests. These tests detect antibodies that are produced in response to syphilis, but they're not specific. The results will show either reactive or non-reactive. Reactive means positive, but remember, there can also be false positives. Or it is reactive due to other conditions like autoimmune disease or acute febrile illnesses. If the non-treponemal test is reactive, meaning positive, we confirm the diagnosis with a treponemal test that detects syphilis-specific antibodies.
Got it. So, if both tests are positive, does it confirm the diagnosis?
Yes, however, there are also some situations where the non-treponemal and treponemal tests don't agree, which can make it confusing. If the non-treponemal RPR or VDRL test is negative and the treponemal test is positive, it might suggest a prior infection with syphilis or a really early infection. Remember, there can also be a false positive on the initial non-treponemal test.
What about the titers when the RPR is reactive?
A titer will also be noted for non-treponemal tests. Higher titers generally indicate a more active infection, but they can also be influenced by other factors, like the stage of the disease or response to treatment. Treponemal tests are usually reported as either positive or negative without specific titers. It is always best practice to follow a reactive non-treponemal test, the RPR or VDRL, with the treponemal test to confirm diagnosis. The patient's clinical history, symptoms, and lab results will help with care and treatment decisions. Does that give you a better understanding of syphilis testing?
It sure does. Thanks.
As a perinatal nurse, you must be prepared to identify emerging threats to your patients. A1 has resources for nurses to support the care of people diagnosed with syphilis and other emerging perinatal threats.